A pleasant good morning, ladies and gentlemen. May I present to you my research study entitled Comfort Measure Practices of Psychiatric Nurses on Patients with Mechanical Restraints, Basis for Enhancement Program. The use of mechanical restraints in a psychiatric facility is a typical practice and has become a routine intervention in controlling violent and disruptive behaviors. Unfortunately, there is a tendency that psychiatric nurses may overlook the therapeutic practices accompanying such treatment modality. Without proper application and comfort measure practices, restraints could result to adverse events such as physical injuries and psychological consequences. The study aims to assess the comfort measures provided by psychiatric nurses to their patients based on mechanical restraints and to determine the level of anxiety of these patients as perceived by the psychiatric nurses. The study employed descriptive correlational research design because this study seeks to discuss and describe the comfort measure practices of psychiatric nurses on patients with mechanical restraints. It also seeks to determine the levels of anxiety of patients as perceived by the psychiatric nurse respondents. And lastly, this study seeks to determine whether the perceived level of anxiety of patients is a factor or affects the comfort measure practices rendered by psychiatric nurse respondents. 80 psychiatric nurses respondents were selected purposefully from the different receiving pavilions or acute pavilions of National Center for Mental Health, namely, or specific pavilions are Pavilion 1, the Acute Adult Male Pavilion, the Pavilion 2, or the Acute Crisis Intervention Section, and Pavilion 3, or the Acute Adult Female Pavilion. The questionnaire or tool was primarily developed based on the experiences of the researcher in handling mechanically restrained patients, from skill checklists for tailored clinical nursing skills, from procedure checklists for fundamentals of nursing, and other related resources that will come up with the most relevant variables that will best describe the study. The variables used in the questionnaire are lifted from Kolpaba's theory of comfort, namely relief, ease, and transcendence. The respondents were asked to rate the comfort measure for each level of anxiety using a 5-point Likert scale. And overall, a total of 75 items were presented in the survey questionnaire. Since the questionnaire is a research-made questionnaire, it was submitted to the advisor for correction and improvement. Then the questionnaire was validated by 3 experts in the field. Pilot study was conducted. The completed questionnaire from pilot study underwent Cronbach's alpha for reliability testing and had a score of 0.76. The study was further reviewed and approved by Ethics Committee in National Center for Mental Health before proceeding to data gathering procedure. The research questions were administered personally by the researcher. The findings. The respondents reported to have provided comfort measure to 296 patients with mechanical restraints. Based on the pie graph, the respondents perceived that majority of their patients with mechanical restraints have moderate anxiety, while a minority of their patients with mechanical restraints have severe anxiety. Also, the psychiatric nurses perceive themselves as very satisfactory in rendering comfort measures on all of its 3 forms. However, specific practices like loosening the restraint and exercising the limb of the patient, making sure that the patient can slightly move while on restraints, and doing back tapping yielded relatively lower NIL scores. And lastly, the perceived level of anxiety of patients with mechanical restraints is not a factor in the comfort measure practices by the psychiatric nurses. Conclusion and recommendation. Emphasis should be given more on the 3 comfort measure practices that garnered the lowest mean score to prevent possible complications that may arise while patients are on mechanical restraints. Enhancing each of these comfort measures will not only prevent complications, but also to hone the knowledge, skills, and attitude of the psychiatric nurses in order to produce globally competitive holistic nurse. A comprehensive enhancement program was proposed consisting of practices needed to be enhanced, the activities, the participants, the measurable outcomes, and the budgetary requirements. This program may be adapted to ensure that mechanical restraints-related complications will be avoided. Salamat. Thank you po.